Dhanvantare Namaha. A warm welcome to everyone gathered here. Coming together is a beginning. Keeping together is progress. Working together is success. So let's work together to lead a successful life. On behalf of Nandha Ayurveda Medical College, we welcome all our dignitaries, guests, doctors, parents, as well as well-wishers. When you pray for someone, you are offering them the most purest kind of love. It is true that a prayer that comes from the heart can move mountains. It increases your faith and brings you closer to God. So let us begin the day with the prayer.
Shuklam Varadharam Vishnum Shashivarnam Chaturbhujam Prasannavadanam Dhyayet Sarvavighnopashantaye Saraswati Namastubhyam Varade Kamarupini Vidyarambham Karishyami Siddhir Bhavatu Me Sada Om Namo Bhagavate Vasudevaya Dhanvantaraye Amrita Kalashahastaya Sarvamaya Vinashanaya Trailokyanataya Shri Mahavishnave Namaha Shri Mahavishnave Namaha
Leaders are made. They are not born. They are made by hard effort. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader. So, I would like to call Dr. Sandeep Vishwanath, Assistant Professor, Department of Rashashastra and Vaisajya Kalpana, to welcome the gathering.
Very good morning to all. Today, we are observing World Cancer Day, on February 4th. So, it's a nightmare for the public to have cancer. Or rather, it was because the recent researches and recent advances in the medical technology has made it is a curable disease. And it is not more a very dreadful disease nowadays. If you are finding it at the correct time and given a proper scientific treatment, it is 100% curable. And on the part of this World Cancer Day, we have also arranged a webinar on this breast cancer awareness from the talk from Dr.Suresh Kumar. On this occasion, my duty is to welcome all the gatherings. Let me start my duty. First of all, I would like to invite Thiru V. Shanmughan, Chairman, Sri Nandha Educational Trust. I welcome you, sir. Next, I would like to welcome Dr. Sri S. Nandha Pradeep, Secretary, Sri Nandha Educational Trust. Even though he is not in the meeting, I am welcoming him, sir. Next, I would like to invite Sri S. Tirumurthy, Secretary, Nandha Educational Institutions, for this webinar. Next, I would like to invite Sri Arumugan sir, CEO, Nandha Educational Institution, for this webinar. And next, I would like to invite our chief speaker today, Dr.Suresh Kumar, radiation oncologist, Government Hospital Perundurai, as well as the consultant in Erode Cancer Center. I welcome you wholeheartedly. I welcome you, sir, for this event. Thank you. Next, I would like to invite Dr. M. Kritika, our principal. She is the constant inspiration behind all our endeavors. I am inviting you, madam, for this webinar. Next, I would like to invite Mr. Apollo James, Administrative Officer, Indian Medicine Campus, Nandha Educational Institutions, for this webinar. Next, I would like to invite all the teaching and non-teaching staff of Nandha Ayurveda College and all the Nandha Educational Institutions for this webinar. And finally, I would like to invite all the participants of this was joined for this webinar for the session. Thank you.
Thank you, sir. Problems never stay long. They just put the signature in the experience book of your life and move away. Let us not waste away this day, as it is the only day where the entire world is united in the concern for the curing of cancer. I would like to call Swatika, first year BAMS, to say a few words about today.
A pleasant morning to one and all present here. As we celebrate World Cancer Day today, I would like to share a few words about it. The observance of World Cancer Day is an initiative taken to spread the awareness about cancer, its prevention, detection, treatment, and for the world to unite to fight against cancer. The observance of this day began at the first World Summit Against Cancer held in Paris in the year 2000. The primary goal on this day is to prevent misinformation and raise awareness. The theme for this year is Close the Care Gap. Gap in healthcare refers to the disparities in healthcare access, healthcare needs, and medical services provided to the patients. Breast or the mammary gland has its own importance in the female body from the time of puberty. A child receives the life essence from its mother's breast milk. The natural power of breastfeeding is one of the greatest wonders of the world. It is about enjoying being a woman. Breast cancer is the most common cancer in women in India and accounts for 14% of all cancers in women. Breast cancer awareness is an effort to raise awareness and reduce the stigma of breast cancer through education on symptoms and its treatment. This awareness will lead to earlier detection of breast cancer, which is associated with higher long-term survival rates. Many health organizations have published a list of ways in which it is possible to detect any signs of breast cancer by oneself, making it easy to diagnose early. It is proved that patients are experiencing better outcomes as a result of early diagnosis. Let us first start with the family, the neighbors, and then reach out in helping the society. Let me conclude by these words. When you're kind to others, it not only changes you, it changes the world. Thank you. Have a good day.
Thank you, Swatika. Now I request Dr. Sandeep Vishwanath, Assistant Professor, Department of Rashashastra and Vaisajya Kalpana, to introduce our guest speaker.
On this occasion, we are having Dr. Suresh Kumar. He is one of the promising radiation oncologists in Erode as a speaker. Sir has completed his MBBS from Madras Medical College in the year of 2006, followed by post-graduation in radiation oncology from Cancer Institute, Adayar, Madras, Chennai. Sir is working as a consultant in radiation oncology in Erode Cancer Center in Erode, as well as Erode Cancer Center in Tirupur also. And also he is an senior assistant surgeon in Government Hospital Perundurai. Sir has immense experience in the field of radiation oncology and has participated in many clinical trials also. I welcome you, sir, for the speech. This virtual stage is for you now. Thank you.
Good morning, all. I hope you are audible.
Yes, sir. You're ready.
Thank you, sir, for giving a great invite for a meeting. And so this year, every World Cancer Day is like very much important to us because we need to create a lot of awareness where we are having a lot of lacuna in our awareness, reaching out the people and also the among other educated people also. So just it's an effort to reach awareness is like bit difficult in rural areas and other areas, which is now concentrated by the WHO. So they wanted to make it happen through a theme that is given this year just to close the care gap, because once diagnosed with cancer, most of them couldn't also reach out the place to get their treatment. And most of the people, like in America, they have awareness, and whereas in India, the awareness among people is very less for many cancers. So just given a short time, I just wanted to highlight awareness about the breast cancer, because that's the most common cancer. What we are facing now. And as we know well that breast cancers, like we would have heard about many people around us itself, and the cancer incidence is also coming high. So just we need to close the care gap where what else could be done at the breast cancer area. So we very well know that breastfeeding lowers our cancer risk, which is a culture, like it is almost like bound in our culture itself. That's why we want to avoid like artificial feeds for almost 6 months, and as much as possible, the mother has been advised to give breastfeeding. But nowadays, it's the things are changing because the mother is either working or she is not like that fit enough to feed also, because she's nutritiously, like she's anemic, she's having a poor nutrition and lower socioeconomic status. These are all the things which makes them not to feed also. So these are the factors which are like increasing the risk for the cancers. So breastfeeding almost gives a protection, because like enzyme level also, I will come to it later. And for the kid also, the breastfeeding makes a change, because it it gives a very good protection against most of the cancers, and there are many studies onto it. So as you know, there are many theories which the cancer has been found out, and what is the target, and how long will it take. As you know, in Ayurveda, you all very well know, in it's defined as arpuda, because it's a term which was used initially for the cancerous growth. It's not the term for tumor. Tumor is almost benign. This word is specifically used for cancer, and many Charaka Samhita and many sciences say that the cancer, because we as an Indian Ayush medicine, we have very good explanations in Vedic scriptures also. They have observed cancer and they have almost treated cancers. But what we lost is, like, we lost many materials in between, and we are not getting on par with many clinical trials, so that we could prove our own medicine, because we are lacking in those areas. Just I wanted to highlight this thing on today's meeting, because many of you, like, studying in other specialties, they don't know the importance of the thing, what they're like getting into it also, because every form of medicine will have an answer, but those things has to be taken scientifically to the world. So in Vedas and all, they have almost described as, that it's not like it's very easy to cut a tender plant rather than to cut a plant which is fully grown. It's almost applicable to a disease, because there is a small thing which is happening in our body which can be found out earlier, and which can be also cured, but we are almost lacking some ideas about the awareness, so that we couldn't like able to treat that also. So why this meeting? Because there are many other specialties like integrative oncology into the cancer management, because it is almost used in adjuvant therapy and along with chemotherapy and radiotherapy also. And even for post-surgery cases, we are giving to minimize the side effects of the other drugs what we give. And it also slows the progress of the cancer chemotherapy also, because in they say in Ayurveda they've given many stages, as you know very well, that like even they have mentioned vascular formations also. That is why the metastasis occurs, and that's why we need to concentrate on like metastasis also. These things are all like explained very long back, and we have lost it like for many years. Now we are almost exploring, and very happy for that. And these things should be taken to the world, because we had very good medicines, and those medicines are being now patented by like other countries also. I'll just give you example at the end of the session, because we know we are from Erode, and it's it's a turmeric city to the India, and we know the turmeric is not patented here, and many molecules are based on turmeric, and many chemotherapies also based on turmeric. I will show up the slides off late of this presentation. So many anti-tumor activities and cell protective activities are found in our own foods. And this turmeric has been found to be having a lower incidence of stomach and colonic cancers in South India rather than compared to North India, because we use turmeric more. So this is a simple study, and many such studies are there to prove the importance of our own drug. So just I wanted to come back to our breast cancer, because breast cancer, just I wanted to take this topic in a light way, because we will be interested, though in treatment part differs in like in every methodology. So just I wanted to highlight certain things which should be known to all, and which should be like given importance, and which should be like conveyed to other whoever you come across. Because what all the things which makes the breastfeeding to protect us is like breastfeeding gives us breast cells to like they don't go for a change up, because estrogen is the main factor which is implicated in the production of cancers. So how long the female is apart away from estrogen is the thing that is counted for the development of cancer. So if her mother is breastfeeding for almost 3 kids for almost three years plus 3 years of pregnancy, 6 years, the women will be out of estrogen and she will be under progesterone control. So that's the way the breast cancer cells are not able to grow in a women who have fed very well with breastfeeding. And there are evidences, because that's where the allopathy came in also. The evidence-based medicine is what we are looking into it. And there are many evidences and there are many studies which have proven that the estrogen is the factor which is causing a cancer. And avoiding how to avoid estrogen in a natural way, that's what is like about breastfeeding. So they have provided very greater protection to the women against the breast cancer. So we also know about menstrual cycles, because menstrual cycle is divided into like in 28 days. There in between menstrual cycles also there are estrogen and progesterone. Hope you will also be reading it through in some other methodology also. So the estrogen cycle has an impact on the growth of the breast. So we need to have a control on it. So any control that is lost over a course of time is what is like changing into a cancer. So just I wanted to highlight the studies that was published in 2002 itself, where the 50,000 breast cases were being observed, and almost the breast cancer patients who are fed well for 12 months, they have a reduction of almost around 4 to 5% reduction in the breast cancer. So just I will rush up through the data analysis, because why like it is important, why breast cancer is important. So we could see many cases around. Previously it was stated that we almost are facing around 1 in 13. That is like every 13 women you get to see the one will get breast cancer. But now even the recent data have changed that it's about 1 in 8. That is almost 8 out of 1 out of 8 women will be getting breast cancer. It's not like they are at risk for breast cancer. It is almost said like they will be getting breast cancer. So hope like if in Nandha College, if you're having around students of around 7,000, so almost 1 in 8 will be around some 600, roughly I'm saying. So all 600 of you among yourself will also be at the risk of getting breast cancer. So where to avoid, like how to avoid is the one thing, and how to get it known, that is the other thing. Apart from the breast cancers, we also have like cervical cancer. That is also a very big topic, because cervical cancer is almost a preventable cancer, like preventable cancers, because cervical cancer is influenced by the growth of human papilloma virus, which can be uh, stopped by vaccine, like corona vaccine, like the like human papilloma virus is also like we could stop it by the help of vaccine. So I will leave apart with cervical cancer because that's a big topic. We'll go forward with breast cancer around. So the breast cancer patients, the incidence is very high. That's why we need to find out. Also, this is the data which says that how far we can save the patient. If the patient is diagnosed in stage 1, almost 90% we can cure them. Whereas if it is diagnosed in stage 4, we could cure only 15%. This also says that every 30 minutes we are losing a woman out for breast cancer. That is the data from India. Like every 30 minutes we are losing, because we are all found out at the late stages, maybe 3 or 4. So if we could make it early, we could make it, diagnose it early. So there will be a very good chances of curing. And many methodologies, many drugs, many studies have been like upcoming with many modules for the complete cure also. So risk factors is like from birth to age 39, the risk factor is like 1 in 30. It's a risk factor. It's not like incidence. So whereas the risk factor increases as the age also increases, there also you could see like above 60, the risk is almost 1 in 30. And also if you any one of you is having any personal history of familial history of breast cancers and any genetic alterations, any race, certain race is also like more prone for breast cancers. And if they have received any sort of radiation for any treatment, so these are all the things which are known to cause breast cancer in future ages. As I mentioned, this late pregnancy or no pregnancy, because pregnancy is the only factor which have a influence on the estrogen, and that is why the breast cancer cells are not able to grow in our body. Whereas without estrogen and without progesterone and with high estrogens, the breast cancer cells will be very happy to grow in our body. So a late pregnancy, because we should be getting like that's why pregnancy like above 35 is a very high risk pregnancy also, because breast cancer risk is also going high. So this is the study of breast cancer with lactation, because breastfeeding was given importance. So I don't want to more confuse about the statistics, because this will be big bit confusing wherever we go. We don't want to believe upon the statistics, but just we can make it very short, like any age about 25 is at the risk, and anyone we should always breastfeed the patient, get married earlier. You just forget about the cancer and just have a routine recommendations, because screening is a big tool for diagnosing breast cancer. And that's why this year it's been designed for the theme has been designed so, because we need to close the care gap where the availability of awareness is increased and availability of diagnostic tools is also increased. So maybe just I wanted to rush through the symptoms, because every symptom has been noted mainly by the patient itself. Later only they come to other like they come to doctor for diagnosis. And these are all the symptoms what the patient's presence is. Maybe they can themselves note a lump in their breast, or a changes in the skin, or a discharge from a nipple, or something redness or some swelling sort of things. They could themselves make it, and these are the signs which they should surely come to the doctor. And if at all, if once if it is diagnosed, that is the later part. But breast screening, what can be done at the earliest stage? So breast self-examination is the thing which we advise. So any girl who after around some 20 years, they should have a self breast examination monthly once. I will also say the dates when they should go for the breast examination. So they should have a self breast examination where they themselves can make out a small changes in their own breast. And once a year, they should go for a clinical breast examination that should be done by any doctor who is nearby. So they can get done a clinical breast examination, because sometimes a few women will be missing and few will be like afraid to show their own like fibroadenoma will be there, and they will be afraid that is something like cancer. So these things can be avoided when if it is shown to a doctor. And there are screening mammography which has been highlighted in many clinical guidelines. So for self-examination, we need to start after once our periods gets over. We need to start after 2 days after our periods, because during periods, breast will be somewhat tender and it will be like misdirecting ourselves. So we need to have a breast examination after completion of periods. Maybe we can take it around 2 to 5 days. That is the ideal period where we will come to know what is exactly in the breast. So every month after periods, every woman has to undergo this self-examination. Please take a note on it, because you need to do yourselves, and you need to convey this to your own parents and other siblings also. So this is how you need to get checked in all the directions. So these are either you should come from above to down and down to above and in a circular motion. And you also should lie down and also feel with the tips of the finger. So once if it is done, if it is having any doubt or something, yeah, mammogram has been advised, like previously it was advised in 50 years and above. A mammogram is like it's like an X-ray technique only. It was advised 50 years and above. Now it has been incorporated in 40th age itself. So what is the importance of mammogram? Because this is a very big diagnostics tool that has been invented, because many lump, those which is having changes, even before the presentation of lump, before we could see it as a lump, before the patient could feel it as a lump, there will be some architectural changes happening within the lump that is almost like pathognomic for the cancers. Cancer cells will always invite calcification within themselves, and these calcifications can be picked up with the help of mammogram. So that is where the sensitivity of the testing lies in. And mammogram helps in diagnosing a cancer even without the appearance of a lump. So that's why it is brought into a screening tool. And mammogram, it could also, as I mentioned, it's like very typical calcification, that is 300 milli, and which are very much branching, and certain patterns are there to diagnose it as a cancer. And microcalcifications are found out, and even the non-palpable lesions we can get to diagnose with the help of a mammogram. So this is how the technique is taken. It's taken in double view. It's either from cranial to caudal and from medial to lateral. And you can also visualize the like cancer cells there. Small spicules of cells are there. These are diagnostic of cancer. So what should be done? That is the where American Cancer like guidelines is given. So we should almost start mammogram from the age of 60, and so from the age of 40, and for every year they should undergo a mammogram, and after 50 years they should undergo it for twice in a year, because we are at an increased risk, and almost nowadays they advise it every year. Mammogram should be taken for all women above 40. If they have any family history of breast cancer, they should be undergoing from 35 itself. So even if you're having a doubt with 25 years, you should not go for a mammogram. Rather than nowadays with MRI that is combined with an ultrasound is very much helpful in finding out the disease. So once if we are found out with the cancers, once if we are having a suspicion, then we should almost go for a test, that is to confirm the presence of cancer cells within our tissues. So there are certain techniques where we should go for a diagnosis. This is the needle technique where the cells are being found out and we could also like take the cells out of it, and we could do microscopic examination, which will prove the cancer. So once the cancer is done, we should almost go for the treatment. And I know very well that like treatment as such differs in different methodologies. And basically nowadays the chemotherapy plays a major role in breast cancer, because breast cancer is no more a localized disease. Almost, since it is due to the growth, it's due to hormones, it is almost a systemic disease, and we should approach it through a systemic pattern. That's where the chemotherapy came in also, and surgery to remove the bulk of the tumor. And there are hormonal tablets are there, and many treatments like radiation, what we are specialized in, are there to shrink the volume of the tumor. And like we could also eradicate the tumor cells with the help of radiation. So just we don't want to get panic about radiation, because there are many techniques and many things to be explored, and it's a very big science, and many thing has been changed. And as we know, like mobiles, it's been updated every day, and they like the same way the radiation is being updated, like every week they are being the upgradations and radiation, and it's almost having a very good control over the tumor cells. So just treatment part, I don't want to go like more into treatment part, because that will be like contradicting to like other methodologies of treatment. But anyway, what else can be done is like we could also see the like interlinks between the other methodologies, because we also use like certain treatments from Ayurveda and like naturopathy and Siddha also. Many things which is being used are some certain herbs and formulas which are used in adjuvant therapy for chemotherapy, and even radiotherapy induced mucositis. We have given Tripalati, and we have given a study on this Tripalati also from Nandha. Only Nandha students only did the study, and those things are very much helpful, because certain drugs, certain supportive drugs what we give also have few side effects, whereas the drugs which is like from the herbal preparations, they're having very almost negligent side effects, and the patient is also having a very good complaints. So there are drugs which works wonder, and I request all of your students like to go for like in-depth study of most of the drugs which has been used in a herb level in an ancient period, and what is its molecular formula, and what should be done further to take it into a big market. These are all things which nowadays the students should concentrate more, because we have a lot of medicinal plants. You even know, like paclitaxel, that is the drug given in breast cancer, that is almost driven, it's found in Western Ghats. It's mostly found in Western Ghats. It was initially found to be a bark of a tree, but later it was diagnosed it as a fungus that is in the bark of the tree. So that is where the paclitaxel drug is being taken. And like many medicinal plants are being given for lung cancer, ovarian and breast cancer, because all these cancers respond well to paclitaxel. So that's why. So as just a take-home message is like we should be like, the cancer accounts for almost 14% of women. The breast cancer accounts, and every 13 minutes one patient has been diagnosed, and we are almost losing a patient in every 4 minutes. And this is the data which is like previously said that it was 1 in 28. Now it is urban. They have separated between urban and rural. Now it's rural is almost in 1 in 13. So hope we can win together, and you will also have a you could because being a student you will also have a high profile to get advice to other persons in among your family and relatives. So promote breastfeeding well to avoid breast cancer, and also even if they have crossed the feeding age, just we need to go for the cancer screening also, because cancer screening plays a big role in diagnosis, and also we have a very good life expectancy. Thank you, sir. So thanks for all your presence and patience also.
To be inspired is great, but
If
to
anyone
be
is
an
having any doubt
inspiration,
also, you can just get to ask, so that I will clear it if possible by this time, because I didn't go through any treatment, and I didn't take through any other cancers.
That marks the end of the presenting session. Let's take some time for the questions now. Hereby, participants are requested to type your questions in the chat box.
Sorry, can you repeat it?
So now the participants can ask their doubts through chat box.
Yeah, fine. Okay. Yeah, just I wanted to say, you were saying about a drug because hope you're all listening, right?
Yes, sir.
Yeah. You could see the screen.
Yes, sir. It's visible, sir.
Yeah. Because this is the drug which has been now, which was derived from turmeric. And this is now it's done by another biotech pharma, and I'm also a part of it. And it's now like found to inhibit PDL1, which is the which has a mechanism by attaching the cancer cells to the tumors T cells. So this is a mechanism. Because I want to highlight certain things because these things will always have a very good impact on the students who wanted to do research. Because in Ayurveda, you need research, a lot of clinical trials to go for a drug which should be approved by all. So this is how the pattern was taken. Thus, I will run through it because this is how the mechanism was identified, and the patient was given the same drug, and the dosage was given. We have given for many patients, and we have observed a very good response in we observed it in marker levels, and we have observed a pattern in other patterns, and we have observed it almost in checkpoint inhibitors also we observed, and we observed it in the PET scan also. We have seen the reduction of the sizes. So these are all the findings what we have done. Uh, so this takes years for us to go for a drug to get proved. But I wanted you to start with, everyone should start with, because these are all the drugs which are in the pipeline also. So the same way, almost everything, these are all Ayurvedic drugs only. Ayurvedic drugs, it's been taken and it's like molecular forms, and it's almost like we have spoken with many US FDA agencies for approval of these drugs. So every student should first fix your thing during your course itself to get into research, and all of you should come out with a molecule which have wonders, because it's not only pertain to cancer. Many drugs have many effects, and I hope everyone should have a good clinical study also into it. Thank you.
So there is a doubt from Dr. Sapna.
Yeah.
Thank you. A spinster, if her periods is regular and stops at 50 to 52 years, is she too prone for breast cancer as there is no hormonal changes taken in?
Yeah, after it's not so, because estrogen gets stopped, whereas the progesterone will be there. One thing is that, and the changes that occurred even before 50 years are the one which is manifesting even after 10 to 20 years. So if you are smoking in 20, the cancer cells will be found out in 40s or 50s. Uh, because the changes would have occurred earlier, and it would have taken time to manifest. So even before, even after the cessation of periods, the changes would have already occurred. That is, during 30 to 35 or 35 to 50, the changes would have occurred. So these are all the changes which will get manifest in around some 60 to 70. Whereas nowadays we are seeing very young age, but that's not the fact. Even though the periods is lower, there are risks. There are risks because the changes have occurred already.
Thank you, sir.
Yeah.
There is no more questions, sir. Thank you
Fine.
for your
Anything.
valuable session, sir. I would like to call Dr. Chaitanya, Assistant Professor, Department of Roganidana and Vikriti Vikyana, to deliver the vote of thanks.
Good afternoon, everyone. We are at the end of a very informative session conducted as a part of World Cancer Day. I'm sure this illuminating webinar on breast cancer awareness has achieved its objective. I would like to express my gratitude to the Chief Patrons, Thiruvi Shanmugan Chairman, Sri Nandha Education Trust, Sri S. Nandakumar Pradeep Secretary, Sri Nandha Education Trust, Sri Tirumurthy Secretary, Nandha Education Institution for their constant support. On behalf of Nandha Ayurveda Medical College and Hospital, I sincerely thank our guest speaker, Dr.Suresh Kumar, Radiation Oncologist, Assistant Surgeon, Perundurai GH, Erode, for enlightening our students with an eye-opening session on breast cancer. And the clinical experiences which you shared are very inspiring. Thank you, sir, for spending our valuable time with us. I also thank our beloved principal, Dr. M. Kritika, for her constant support and guidance for making the event a great success. I would like to thank Mr. Apollo James, Administrative Officer, Nandha Indian Medicine, for all your support. Finally, I thank the audience, especially the students, for making this an engaging session. I hope all of you had a fruitful time. Thank you, one and all.
Thank you, ma'am. There is a can in cancer because we can beat it. Let's end the session with Shanti Mantra.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः.
Thank you all. Let's rejoin again with an interesting topic soon.